Tell me 3 myths about men's health.
पेशेंट पूछे सर मैं बहुत ज़्यादा अगर मैस्टरबेट करता हूँ तो मेरे लाइफ में कुछ प्रॉब्लम हो सकती है क्या? विल आई लूज मसल मास? विल आई लूज हेयर? इज ओवर मैस्टरबेशन गोइंग टू मेक मी इम्पोर्टेंट?
How much masturbation is too much? अभी काफी टाइम से चलता रहा है No-fap मूवमेंट. उससे कुछ एडवांटेज है?
There is a lot of porn addiction in society. So porn rewires your brain. It alters your perception of pleasure. Unrealistic expectations because they see something in porn and they want that in real life. They want penises as hard and as long as porn stars. Any kind of remodeling of God's work is always expensive. That's the way I put it. कि ये चीज like a little bit of discomfort is okay for me. A little bit I'm okay with pinching. I'm okay with a little. I enjoy spanking. But yeah, it should not be spanking so hard that it leaves a mark on my body. I don't enjoy that. This has to be communicated before. Like for example, spanking. You should enjoy that spank. It should not be a hurtful spank. It should be a spank that maybe just makes you feel good about it, but nothing painful. Traditionally, no one has been taught that you can take this easily. A lot of men view sex as just a quick release. If you see women, they have an excellent support system. Their mothers, sisters, friends. They're more easy talking about their problems. As men, अपने को क्या सिखाया जाता है? Keep your problems to yourself. If you space out, if you control your mind, if you enjoy the experience, you can last longer. There are natural methods to last longer.
हमने जो पॉडकास्ट में इस बार गेस्ट बुलाए हैं वो एक यूरोलॉजिस्ट है और उनका नाम है डॉक्टर यश गोडबोले. एंड उनको हमने बुलाया इसके लिए क्योंकि हमको कुछ टॉपिक्स के बारे में जानना था. इम्पोर्टेंट टॉपिक्स है जैसे मेंस सेक्सुअल हेल्थ. इसके बारे में बात बहुत कम होती है. एंड उसके बारे में जो मिस इन्फॉर्मेशन है, गलत इन्फॉर्मेशन है, और उसके बारे में जो फैक्ट्स लोगों को पता नहीं है, जो इम्पोर्टेंट है, जो लोगों को हेल्प कर सकता है, वो हमने इस पॉडकास्ट में डिस्कस किया है. सो आई होप यू गाइज एंजॉय दिस पॉडकास्ट. ये पॉडकास्ट बहुत मज़ेदार हुआ है. इसमें बहुत सारी चीज़ें आपको पता चलने वाली है. सो इसको एंड तक देखना. एंड मुझे पता है आपने सब्सक्राइब डेफिनेटली किया है. सो गाइज टू एंजॉय. So, tell me 3 myths about men's health.
I would say the 3 biggest myths which we come across is सबसे पहले कि पेशेंट पूछे सर मैं बहुत ज़्यादा अगर मैस्टरबेट करता हूँ तो मेरे लाइफ में कुछ प्रॉब्लम हो सकती है क्या? विल आई लूज मसल मास? विल आई लूज हेयर? इज ओवर मैस्टरबेशन गोइंग टू मेक मी इम्पोर्टेंट? This is the first common myth which we come across in urology, mainly in andrology patients which we come, and we keep telling that no, as long as you have other things going on in your life and you maintain a healthy balance, masturbating even every day once or twice is not unhealthy as long as it's not the sole focus of your day. So that's one of the biggest things. Second is if I undergo a vasectomy, will I become less of a man? Will I lose my testosterone levels? जो मेल पेशेंट्स आते हैं काफी जिनको alternate birth control method चाहिए, वैसेक्टमी के बाद मेरी मर्दानगी चली जाएगी. That is another very common myth which we come across. And yeah, I mean you would see that these myths are mostly around sex because most men are like when they come to me, it's either because of stones, prostate or sex. These are the most commonest reasons they come to me. And third sexual complaint which patients come up with is, are certain cultural practice or certain beliefs going to impact my sexual life? And if I do a certain thing in such a way, will that make me less of a man? Will that make me impotent? So these are the most commonest myths which come in our day-to-day practice.
And since you mentioned masturbation, तो भी how much masturbation is too much? मतलब क्या उसका कुछ ऐसा है?
As such, I'll tell you, too much is when it impacts your daily function and daily life. For some people who have a larger or a higher sex drive, they may go at it once or twice a day. Some may do it once in a week or so. But I would say whatever lets you function healthily, once a day, twice a day is good enough. Alternate days, perfect. There is no over masturbation. It's your appetite. Some people have more of an appetite, some people less. As long as masturbating is not the sole focus of your day, and you're not wasting your work hours in it, I think it's fine.
और ये जो मूवमेंट चल रहा है अभी काफी टाइम से चलता रहा है No-fap मूवमेंट, उससे कुछ एडवांटेज है, कुछ बेनिफिट?
Advantage is it teaches you self control. I would say the first is self control. Okay. Right? It gets your mind out of sex. It gives you a month to rewire your brain. Okay. So now that you've touched on the topic, there is a lot of porn addiction in society. So porn rewires your brain. It alters your perception of pleasure. So I would say that No-fap teaches you to untangle from these external stimuli, get in touch with yourself, reconnect your body's hormonal balances and establish homeostasis. That's the main function of no-fap, I would say.
अच्छा. और मतलब ऐसे रिसर्च ने नो फैप को टेस्टोस्टेरोन लेवल से कुछ लिंक किया है, मतलब नो फैप करने से टेस्टोस्टेरोन बढ़ता है, कम होता है, ऐसा कुछ है?
Well, not necessarily. I think testosterone levels have a multifactorial cause, you can say.
Okay.
No-fap may, of course, cause an increase in the testosterone levels. But there are other things in the background that also have to be considered. Patients' otherwise blood work, their otherwise existing comorbidities. We are living in one of the most stressful times in history. So stress, your lack of muscle mass, lack of exercise, unhealthy lifestyle, these things also impact. Yeah, so if no-fap is a component, you have to look at these other things also of the patient before you reach a conclusion, I would say.
क्योंकि आई थिंक what people believe is अरे नो फैप करेंगे तो मेरे पास सुपर पावर आ जाएगा, समथिंग ऑफ दैट सॉर्ट. एंड आई थिंक नो फैप करने से testosterone levels is one thing, but does it improve your sex life?
So first of all, as you said, superpower, I think that there is no superhuman. I think that every human is super. This no-fap just teaches you a better self-control, right? It rewires your brain. So the thing which you take for granted, ejaculating, men can ejaculate very easily. A few minutes or few hours, depending on that, you can ejaculate few times a day, and therefore the more you do it, the less valuable it becomes. I think no-fap just establishes the value, and it creates a drive again. That natural drive, that natural hunger. It's basically it's a natural hunger to want to mate. It rewires your brain and it lets you focus on that. You basically appreciate it after staying away from it. Right. It's like fasting. Yeah.
क्योंकि मैं क्यों पूछ रहा हूँ, क्योंकि if you think about it logically, if you know fap for some time, and so basically you are not like having an ejaculation,
right.
तो फिर when you do the actual thing,
right,
तो like let's say for example people having premature ejaculation,
right,
तो उसमें कुछ फर्क पड़ता है उससे?
पड़ सकता है, but again, so you have to realize that the ejaculation is basically expulsion of semen. So your testes and all your other apparatus have a fixed amount of volume they can hold. So no-fap में once a certain level is reached, you will have emission in the form of nightfall. So ऐसे नहीं कि आपको infinite storage capacity बनेगी, बस it will just rewire the processes, it will store as much as you need, and it will get rid of the rest. So your question was, does it improve the premature ejaculation? It may not, because premature ejaculation may have a psychological factor to it. So until that psychological or those physiological factors aren't solved, your premature ejaculation isn't going anywhere. It may just enhance your pleasure, but PE not guaranteed it will have any impact on that.
And talking about PE, अभी PE is such a big thing.
Yep.
तो फिर what are the main reasons for PE?
So of course there's many reasons there, but we'll start with the commonest problems first. So premature ejaculation is a minute or less. You're ejaculating in less than a minute or so. Biggest problem we come across in andrology patients is the first foremost is psychological. It's either situational, psychological, either due to a lack of sexual experience or the whole excitement of it all. Traditionally no one has been taught that you can take this easily. A lot of men view sex as just a quick release. They don't consider the female's pleasure. They don't consider mera ho gaya bas wham bam thank you ma'am. So it should be that you need to space it out, enjoy the experience, right? Don't treat it as a chore that you have to do. First, psychologically, if you just talk to someone, you just have a detailed discussion with your experienced andrologist who can tell you, listen boss, आराम से करो, enjoy करो, set the mood beforehand, talk to your partner about what your expectations are, maybe something you don't like about it, or maybe some other traumas, or maybe some psychological stresses you have in the background. Deal with those first. Once that is dealt with, then we will deal with the other factors, whether the patient is in depression, whether you have any metabolic anomalies, diabetic or hypertensive or what not, whether you're on certain medications that may affect it. Those are then multifactorial treatments which we tailor make as per the patient. But those like, need to be addressed.
For an healthy individual, जिसको otherwise कुछ नहीं है, and उसको अभी that person wants the whole thing to last longer.
Right.
तो उस केस में you're saying कि mostly वो psychologically होता है.
Most commonest cause is psychological. The commonest, if you did a subset of patients, the commonest is a psychological presentation. And with simple medications, these patients get a lot of relief.
और उससे कैसे deal कर सकते हैं psychological?
So first is talk. As traditionally as men, especially Indian men, no one is taught to talk about their problems. If you see women, they have an excellent support system. Their mothers, sisters, friends, they're more easy talking about their problems. As men, अपने को क्या सिखाया जाता है? Keep your problems to yourself, boss. We've seen it with our parents, grandfathers, and so forth. That men sit on their problems. They sit on it till they become a scar in their body, and in their mind rather, not in their body. And that scar later on manifests in these forms. So talk. First and foremost is talk. If you can't talk to your spouse, you should be able to talk to your spouse. If chalo, you're not able to talk to your spouse, talk to a doctor, talk to a professional therapist or a urologist or an andrologist, talk to a professional. Get your thoughts out, and you will realize that once you talk it out, you see the problem from a third person perspective. Simple talking also can have magical effects on the patient.
Okay.
Yeah. So I'd say that is the first foremost. Then of course, for those who have organic issues, we have to tackle it step by step. If there's any endocrinopathies as we call them, or if there's any other metabolic evaluation needed, we do that and then we can work on it. And of course then we start medication and other therapies which we will discuss.
So healthy individual के लिए एक तो talking it out हो गया.
Yep.
So what are the other things that can help ki, for example, staying fit, exercise?
Yes, absolutely. A healthy exercise regimen and a good sleep cycle. So you know that your steroidogenesis is in the evenings and early mornings. So good sleep cycle is essential to maintain that balance. Secondly, an exercise schedule. Testosterone levels are linked with muscle mass and bone density. You have to work out regularly. You have to maintain a critical muscle mass for optimum health. And that has miraculous effects. The endorphin release, so many biochemical phenomena which happen in the background that enhance the performance and well-being of a male. So those have to be there. In fact, we are seeing a lot of unhealthiness in our populace. A lot of men are, not at their healthiest. They have stressful lives. They're eating, drinking, whatever they like. There's no regimented routine. And as a result, they're losing out a lot in life on many fronts because of that.
Right. And chalo, this is premature ejaculation. So you are a urosurgeon.
Yep.
Abhi, so you have done MBBS, then specialization, then super specialization. What? Yeah, as in, if somebody wants to be you,
Wow. Okay.
what should that kid do? How? So I'm asking this because obviously you are doing an important job. You're doing important work in society. So it's a good place to be in. कि ठीक है, मैं भी ये करूँगा, मैं भी इतना पढ़ के, even I'll be able to help the society.
Right.
So, but how has that journey been?
That journey, it's a very, very tough question. Actually, the journey has largely been good. There's been more difficulty than peace, right? Through your training, it's complete rigorous donkey work. But there are few moments in your career where no matter how hard or how bad the days are, just one or two events you need, in a few months in your training that bring you back on track. Nahi bhai, I'm on the right track. I'm meant to be here. But yeah, if you have that resilience and if you just keep yourself focused on the end goal, the end is beautiful. But yeah, be prepared that the payout of happiness, I'm not talking about any other factor, but the happiness of treating and satisfaction of treating your patient is a long and arduous journey. You are going to make mistakes. You are going to get yelled at. You are going to be outcast for your wrong decisions. But if you survive through all that, at the end, that smile on your patient's face is worth it all. Just one life, if you can touch honestly and well, it makes all those hard days worth it. But yeah, you have to have resilience. You have to be prepared that no 2 days are going to be the same. The journey is hard, but it's worth it. In the end, it's worth it.
Yeah, because आजकल क्या है, if a patient comes to you for consultation, तो उनको मतलब they see it as मैं तो 15 मिनट मैंने डॉक्टर के साथ बिताया और whatever the consultation fee is, मुझे 15 मिनट बात करने का इतना भरना पड़ रहा है, बट मुझे वही emphasize करना है कि it's not just those 15 minutes, it's 15 years.
Exactly. You are talking to someone who is compiling decades of experience, trial and error, learning from other people's mistakes, learning from the entire science, and that 15 minutes is a calculated response of that. So towards the patient, the first and foremost is your communication. You have to establish a bond कि भाई हम same team पे, मैं तेरी टीम पे और तू भी मेरी टीममेट है, and I'm going to take care of you like my teammate. I'm your captain for today, but it's my job to get you across the finish line. If you establish that trust, touch wood, I've not had problems with patients because of this approach. कि ठीक है, patients come with preconceived notions, they come armed. If you relate to them on a human level, इंसान को इंसान की तरह treat करो, और वो इंसान will then open up to you. Because you're dealing with men who have been mostly in andrology. In urology, you deal with females, males, all. But mainly, I'm talking in the perspective of andrology, you're dealing with men who come as it is with a lot of guard on their guard on, and of course then all these other things कि मैंने 15 मिनट के इतने दिए तुम्हें 1000 रुपए दिए 1500 दिए whatever. So in order to make it worth that time, you have to reach out to them as a human. If you make them feel good about themselves, not let them feel any shame for what they're coming for, they will walk out of the door with a smile on their face. And that first mental smile कि यार I feel good is the path of healing, is where the healing has begun, I feel.
अच्छा, and you mentioned andrology.
Yeah.
So first of all, ठीक है, urology तो ठीक है, problems for like if we had to tell people.
Yeah.
तो urology क्या है and andrology क्या है?
So basically, urology is the science or the surgical practice of genitourinary system that involves all the way from your kidney to the tip of your penis or urethra in females or the vagina. Of course, the vagina, of course, comes in the jurisdiction of the obs-gyne. We'll not go into that. But anything related to the urinary tract comes under urology. Andrology is a specific discipline within urology that deals with men's health.
Okay.
जैसे females के लिए gynec है, वैसे मर्दों के लिए हम andrologist है. So any male issue dealing with sexual health, mental health, they can come to us first. We can sort it out and then we can give them appropriate treatment. So we are the male equivalent of gynec. That is what I want to emphasize and get out there. कि आप मर्द हो, आप अकेले नहीं हो, आपके लिए है source. You can talk to us, you can come to us, and we will try our best to solve your problems. Yeah.
And so मुझे एक मतलब बहुत इंटरेस्टिंग चीज़ याद आया कि पहले वो न्यूज़पेपर में कॉलम्स होते थे ना,
right.
where people used to ask the sexpert. तो they used to ask like a lot of interesting questions उसमें. So like that, do you have any interesting case?
Oh, tons of them, tons and tons of them. But yeah, I mean the top one that comes to mind, we'll discuss that. I call it the man and his mistress.
Okay.
Or if you want the 10 Rings of Shang-Chi movie dekhe, वैसे that joke is relevant here. So we had a patient come up. He was a 50-year-old gentleman, right? And this was that he came at 5 a.m. in the emergency room in our training days. Subah 5 a.m. And he walked in, and the reason I know why he came with his mistress, because the first thing he told me is, "Sab, come here. I'm an educated man. First thing आपको बताऊंगा, ये मेरी बीवी नहीं, मेरी मिस्ट्रेस है. You're gonna fix my problem." I was like, okay, but can we get to what's bothering you first? He came in a lungi. We had pulled up the curtains, obviously, just me and 2-3 other juniors. This guy takes off his lungi. We see an engorged penis with metal rings around it.
Oh shit!
And it's like a eggplant, like a constricted eggplant.
Oh shit!
And I'm like, boss, what? Why? There's so many questions. And the first thing that came in is, how? And through the curtains, his mistress is peeping, and she's like, "ठीक होगा क्या?" Madam, we need to wait outside. And I was like,
there were 10 rings.
Not 10 rings. There was about 4 or 5 rings, but they're constricted. So his penis was engorged and was held like. Can you imagine being strangled at 5 different points? 5 rings there. And this was first of all, it was 5 a.m. and everyone is sleepy, groggy, and I'm here looking at this man and these rings, and I'm like, shit, what? How? It's like, I did this to maintain a longer erection. Fair enough. That was your modus operandi. Fair enough. Now we call our bosses, call our head department head, and he's like, why are you calling me at 5 a.m. Sir, as I said this, I don't know what to do. It's like, get a set of pliers, break those rings. Where am I going to find pliers in the morning?
Or they were metal rings.
They were metal rings. And we tried to use our forceps, our hands, nothing was working. And they were quite thick, I would say, about a few millimeters thick. Like, shit, I don't have any pliers on me. I asked all these other guys, like, we don't have any pliers. We sent his mistress 5 or 6 a.m. We sent her to get to a hardware store, whichever is open, get a set of pliers and come back. I don't know how, she's a very resourceful lady. She managed to secure like big heavy duty pliers. We spent 20 minutes removing the pliers, and then there was this waiting and silence. We're just waiting and watching at what happens. Within an hour, his penis returned back to normal. Close to normal. I wouldn't say completely, but close to normal. And we're like, listen, we don't know what has happened. We don't know the damage or the degree of damage to your erectile tissue. We don't know the kind of erections you'll have. Sir, आपने इतना किया, बस हुआ. Abhi, I'll take care of it. I'm like, you're going to need a rigorous follow-up. He's like, no, I'm not going to follow up with you. Obviously, I'm not going to follow. I want no evidence of this. Fair enough, but my recommendation is you follow up regularly. Let us see. Okay, he took our numbers. In the evening, I get a call. Like, sir, ने कमाल कर दिया. क्या हुआ? वापस same erection. मतलब अभी क्या करो? अभी मैं नई device use करूँगा. And I was like, dude, there is no cure. There is no cure for you. But yeah, that was a very unique case early in the morning.
Oh shit.
Yeah.
नहीं, so ये कहाँ से अभी ये सब आइडियाज़ कहाँ से आते हैं पेशेंट्स को कि
अगर पीनस को कंस्ट्रिक्ट करेंगे
Exactly,
तो फिर इरेक्शन लॉन्गर डज इट इवन हैपन?
Well, it does happen, but I mean, it's not recommended that you do these things. It's not recommended that you do it. So I think the internet has caused a boom. Internet and, of course, as we reach the topic of pornography, unrealistic expectations from the partner. Unrealistic expectations because they see something in porn and they want that in real life. They want penises as hard and as long as porn stars. You do realize that there's a lot of augmentation and a lot of injections that go into maintaining those kind of erections and penile sizes and genetic factors. I mean, not every race or every individual is going to have a large penis. So the internet has really perverted people's expectations of reality, I would say.
And since this topic has come up, तो मुझे पूछना है कि कैन द लेंथ बी इंक्रीज्ड, पीनस लेंथ इंक्रीज हो सकता है क्या?
Yeah, it can be increased. Now, but before we go on to increasing penis, we need to know why would a patient want to increase it.
Okay.
Right? So they say कि size does not matter. For some people, yes, and for some females, it does matter. Some women are not satisfied with a small size penis. That is how it is. Okay. So size may or may not matter, but it has to be, the treatment has to be tailor-made. You can't have a one-size-fits-all. But I would say the most male patients try to focus on being a better lover, focus on foreplay, focus on creating the mood. For women, it's all about creating the mood and the build-up to sex. The sexual activity is, of course, pleasurable, but the build-up to sex is equally important. For males, not so much. Even if the mood isn't there, we don't need a lot to get excited as compared to the female counterpart. But yeah, if that doesn't work, and if your psychological well-being is linked to the size of your penis, then yes, there are surgeries and methods for that. There is a method called penoplasty. We do have penile implants also, which can help in increasing the length of the penis. Yeah, that is good.
अच्छा, and तो मतलब सर्जरी होने के बाद भी वो वैसे ही फंक्शन करेगा?
There again, it should function well, but there will be some compromises because when any surgery comes with its complication. So if it's a complication-free surgery, yes, it should function the way it was. For the lengthening and for the functionality to return to normal, it takes time. Because in penoplasty, you are going to be taking fat from other parts of the body, increasing the girth. You will be cutting the penile ligament to increase the length. Implants में आप implant डालोगे तो उधर stretch होने के लिए और for the tissue to smoothen and become remodeled takes time. So yeah, it will take time, but yeah, you will regain your erectile function.
And India में कितना common है? People do it?
Yeah, of course they do it. Of course they do it, but it is more in the wealthy class and the educated class that gets it done. It is more. It is done. It is routinely done. I would say few hundred procedures a year in big setups do occur.
Yeah?
Yeah. In a certain group of setups, not a single setup, but yeah, it is commonly done.
And उसका क्या cost रहता है?
Well, depends. I mean, it's in lakhs. Nothing short of lakhs. The implants itself are very expensive. So the good American implants sometimes go up to 15-20 lakhs. It is quite expensive. Yeah, it's quite expensive. Any kind of remodeling of God's work is always expensive. That is the way I put it. What God has given you, if you're going to modify it, it's going to be a costly affair. It is.
नहीं तो इतना पैसा खर्च करके वो कितना, चलो सर्जरी तो हो गया, रिकवरी भी हो गया, कुछ टाइम के लिए, इट्स अमेजिंग, बट हाउ लॉन्ग डज इट लास्ट फॉर लाइफ?
Yeah, those most implants usually should last for life. Some, unless there's complications or infections, and if a case does go bad, then you may have to take out the implants and put a new one in. So if uncomplicated, then you should be set for quite a good amount of time.
Right. And so क्योंकि क्या है, अभी ऑब्वियसली ये पोर्नोग्राफी ने सबका माइंड ट्विस्ट कर दिया है.
Truly.
तो अभी even if size doesn't matter, like even if a doctor is saying कि भाई size doesn't matter भाई, तो भी just for like aesthetic purposes someone might say कि हाँ ठीक है, nothing is even wrong.
Yeah.
सब सही चल रहा है, लेकिन चलो थोड़ा साइज और ज्यादा
मिल जाए,
हो जाए तो फिर क्या प्रॉब्लम, मजा आ जाए. मे बी नहीं तो so maybe just for aesthetic purposes somebody might do it. So that is a different thing, but like for somebody who has a really small
yes, then it becomes a functional matter because you do need a functional penile size to be able to impregnate the female. So for these people it is indicated, those are born with a micro penis or those born with any other God forbid unfortunate deformities.
And what is that functional penis ka size?
Yes, at least 9 centimeters should be minimum. That
when
is,
erect.
Yeah, when erect. Below that is considered micro penis and that may require intervention.
And what are the other problems like andrology when you say premature ejaculation? तो is just one part. So कैसा है कि चलो ठीक है, sometimes it किसी का प्रॉब्लम ऐसा होगा कि ठीक है while watching porn मेरा act quickly हो जाता है, but while doing the actual thing it takes a lot of time. But does it happen in real life? क्योंकि porn has affected the timings adversely ना, तो मतलब porn ज़्यादा देख रहे हैं तो उसके वजह से they are not lasting longer. But does it happen the other way around?
It can happen both ways. So basically we just discussed the quick functionality of, rather the quick physiology of porn addiction. So porn addiction basically starts as a very subtle act. I compare it to drug addicts. पहले आप एक बार लेते हो, उसके बाद बार बार लेते हो, and the frequency increases to a point where porn becomes reality. It hacks your brain's reward system. Initially, caveman time, you would have to make, even not just caveman, but in modern dating, you would say, you have to make a lot of effort. You have to look good. You have to try to finally get the female to have intercourse or mate with you. You have to put in effort. And that effort is what used to be the thrill for males. But now porn has hijacked all that. You have umpteen number of, beautiful naked women online. Why should I put so much effort when I'm getting the same? End result is what? I have to ejaculate. If I'm getting it online, at the click of a button, why do all these steps of finding a mate? So porn has hijacked that. Yes, it hijacks your pleasure response. It makes, it becomes a default setting for pleasure. कि आप porn देख के आपको pleasure होगा, and intercourse sometimes may feel like a chore. Conversely, you may last more in intercourse and ejaculate quickly in porn because your brain is rewired to think of that as a quick release. Whereas intercourse feels more of a long, arduous process. So yeah, you can have both presentation, but most commonly is lack of performance in the bedroom because of porn addiction. The vice versa is less common. Lasting longer. Yeah, it's less common. Yeah, but it is known. It is a known entity.
अच्छा. And अभी ये porn addiction इतना हो गया है, तो इसको कम कैसे? Do you have like, are there some instructions that you give to your patients?
Yes.
अरे भाई ऐसे करके तुम porn addiction कम करो.
Of course. So I first start off, before jumping onto medical therapies or a lot of medicines, I first start with the simple things. What gets you to go onto the website in the first place? So what gets you to watch porn? What is the tick? What is the ticker in your brain? Ki abhi yaar, I want to go. What is the signal? Identify a signal. For any addiction, identify your triggers. Get rid of the triggers. If it's, posters of lovely women, get rid of that. Fill your time with more meaningful activities. Hang out with your friends. First of all is join a sport. People aren't playing as many sports as they used to before. With their free time, they're just getting a bag of chips, Netflix and chill, bethe, becoming unfit. Get out of the house first is. The moment you feel like you want to watch porn, substitute it with a more meaningful activity. Can be sitting quietly, can be hanging out with friends, playing a game, connecting with your pets, or connect with your surroundings first. Try to identify, many addictions are because we're trying to avoid the real problem. The brain tries to give you pleasure, instant gratification, so that you forget your real problems. Identify your real problems. Once you solve those real problems, you'll realize that these smaller things have no hold over you. So foremost is I try to talk out at my level. If I feel that, as a urologist, I'm not qualified for this, I refer them to a psychologist or a psychiatrist in severe cases. Let them handle that aspect. Once your mind is fixed and once, your thinking is fixed, you'll eventually find yourself detaching from this slowly. But yeah, having a healthy group of friends, having activity outside the house, absolutely. And a support system with your partner if you have one. Makes a big difference.
One more interesting thing यार. तो अभी कैसा है, अगर acidity हुआ, तो we just pop an antacid.
Yeah.
But if you just want to make the erection last longer, by taking a pill, तो वो उतना easy है क्या लेकिन?
Yeah, it is. Unfortunately, it's very easy to just go and buy a pill. But I don't recommend it because these pills, right. So getting to that these pills are very specifically indicated for specific types of patients. अभी हर इंसान को बस erection बढ़ाना है या quality बढ़ाना है तो they should not pop a pill. Those pill also comes with their own side effects, set of side effects.
Okay.
Right? And secondly, those pills are reserved for patients who really need them. Like if patients are not able to be okay with simple measures or psychological counseling, then you give this as a training wheel. Bike में कैसे training wheel रहते हैं. So these are training wheels. They are never meant to be lifelong. Unless there are specific organic conditions where you have to take these therapies, it's not a lifelong. It's a temporary. It should be a temporary fix. And you have many drugs like you have your Viagra, Cialis, all those most common. Now you have even more longer lasting drugs. You have Tadalafil, Avanafil. They last longer in the blood. So they have half-lives of 36, 48 hours or so on. So they give a longer response. So more care has to be given before prescribing them because the longer it stays in your blood, longer chances for complications also.
complications is one part, but
Right.
something like half life. You said you mentioned half life.
Yeah,
तो अभी
yeah,
ये सबसे पहले अपने जो viewers हैं,
Yep.
could you please tell them half life क्या
So
होता है?
half life is the time required for the drug to reach half of its concentration in blood or plasma, simply. So that means even after that, it's still going to be in your blood. So it's going to stay longer and take more time to clear
तो
out.
मतलब किसी चीज का हाफ लाइफ, किसी ड्रग का हाफ लाइफ
Yeah.
अगर 36 आवर्स तुम बोल रहे हो, तो 36 आवर्स के बाद
Yeah.
वो तुमने जितना ड्रग लिया
उसका 50%.
हाँ, आधा जाएगा, लेकिन आधा फिर भी बॉडी में ही है.
Exactly.
तो अभी जैसे आपने ड्रग्स मेंशन किए,
Right.
तो कोई ड्रग का हाफ लाइफ, मतलब आप इरेक्शन के लिए ड्रग ले रहे हो और वो ड्रग का हाफ लाइफ ही 36 आवर्स है.
Yeah.
तो कितने देर तक वो इरेक्शन सस्टेन होगा?
So the erection is sustained as per the act. It is not that it will be non-stop erection. It's just that the ability to reach an erection and maintain that erection at the cellular level improves. It's not like the patient will be walking around with a perpetual hard-on. I mean, that's
that is what I wanted to.
And of course, another point is these drugs only work if the patient feels arousal. They do not change your psychology. अगर आप psychologically disinterested हो sex में, none of these drugs will have effect. You have to first be interested in sex. So we had a patient, very interesting case, that they were married and lot of reasons, like she was his first partner, the wife had partners in the past. At some level that was causing him psychological distress. As a result, he had cut off from her psychologically, and he did not want sexually find her arousing. She was otherwise very attractive and whatnot, but he had somewhere shut down his attraction towards her in his mind for whatever reason. And then he told me that I've taken so many medicines, it's not having any use. Got investigated, seemingly normal on investigation, nothing abnormal. Then I just asked him, I'm like, listen, you've shown so many people and you've come to me with this thick file. I'll just ask you a basic problem. Are you attracted to your wife? And he's like, yes and no. I'm like, what do you mean, yes and no? He's like, yes, I am attracted to her, but there are things about her, things I know about her from her past, is why I can't allow myself. I'm like, this is your problem. All these big reports, unnecessary. Just a 5-minute consultation, and I know that your problem is psychological. We started talking. We sent him to a good couples counseling. He got off all medications, and now they're happy and healthy. So simple, small hack could have prevented that investigation. Could have just solved it in time. Yeah.
तो अब ये इरेक्शन पिल्स लेते हैं, तो आई जस्ट वांटेड टू क्लैरिफाई इट फॉर आवर ऑडियंस कि ये इरेक्शन पिल इरेक्शन को हार्ड करने में हेल्प करते हैं या दे हेल्प टू लास्ट लॉन्गर?
Right. So
दोनों में डिफरेंस है ना?
Yes, absolutely. So they work on both. So basically what they do is they improve the blood flow to that region, and they improve the smooth muscle action there. So they improve the gush of flow there, and they keep the blood there. Eventually, erection is what? Engorgement of blood. They help the engorgement to stay there longer, and they help the supporting tissue to help that engorgement stay longer. So they act on both. So in many cases, they can even help in premature ejaculatory patients as well. So you can solve 2 problems with 1 pill at most times.
नहीं, बट अगर कोई एकदम नॉर्मल है,
Yeah.
ठीक है, और उसका नॉर्मल भी अच्छा ही चल रहा है,
Yeah.
लेकिन फिर भी उसको ही वांट्स टू मेक इट लास्ट लॉन्गर,
Right.
तो वो ले सकता है?
ले सकता है, but I don't recommend that as being your first go-to. I would say first try naturally improving it, try slowly increasing your sexual stamina, and then maybe if that doesn't work, keep this as a last resort. See, we take pills out for illness. That's my perception. So if you're not ill and you just want to enhance yourself, it's like going to the gym. Does everyone take steroid? No, they shouldn't take steroid. That should be a avoidable thing. So let the pills be the last method of treatment in this.
And you mentioned side effects. तो उसे क्या adverse
Side effects most commonly is blood constrictions. Like with some drugs like tadalafil, you can even have heart attacks because it constricts blood vessels.
Really?
Yeah.
You can have heart attacks.
So exactly, that's why these pills should not be started without an evaluation. You should first know whether the patient has a normal cardiac function. Because if you're starting it in an unhealthy heart, you may cause a heart attack or other even more worrisome complications. But yeah, you should evaluate before. That's why I never start these pills over the counter. Always go to a certified doctor, get yourself examined, and then only have it started. So we ask our patients, can you climb 2 to 3 flights of stairs? If the answer is no, then no, these pills are not for you. And then they ask me why. I said, because do you want a heart attack? No, there you got your answer.
तो लेकिन अभी if there is a healthy individual, ठीक है, उसको हार्ट प्रॉब्लम नहीं है,
Yeah.
can that person take these pills on like say a regular basis?
They can, but they should not.
तो वो हार्ट को एडवर्सली इफेक्ट करता है क्या ओवर द लॉन्ग रन?
It will not. It should not affect the heart. If otherwise your vessels, heart, cardiac vessels are otherwise healthy, it should not affect long term. But again, if you are healthy and normal, then why do you need these drugs in the first place?
फॉर रिक्रिएशनल पर्पसेस कि यार मुझे और थोड़ा टाइम चाहिए.
You want recreation? Have a sport. Don't use this as a recreation method, or don't use this to enhance. If you space out, if you control your mind, if you enjoy the experience, you can last longer. There are natural methods to last longer.
No, because ease of access बहुत है ना.
Yeah, absolutely.
कोई भी
absolutely.
जाके and prescription लगता है क्या ये सब
Yeah,
drugs के लिए?
it is a prescribed drug. It is a prescribed drug.
Actually,
Now, enforcement is another thing. If you have a medical owner shop who's your friend, of course, then there are ways around it. But ideally, yeah, these are prescribed drugs.
okay.
Prescribed drugs.
Because that is the problem. No, अभी IPIL तो कैसे है?
Anyone can access it.
OTC over the counter drug है वो. But ये
These are
erection pills है, ये prescription pills है.
Yeah, they are ideally prescription pills.
Ideally prescription pills है.
Yeah.
But वो थोड़ा ग्रे एरिया हो जाता है कि यार मुझे नहीं जाना है डॉक्टर के पास.
दे दो दवा.
हाँ.
There are people who do that, unfortunately.
Yeah.
But it should not be done. It's dangerous. Should not be.
हाँ. So like you mentioned simple things.
Yeah.
कि यार तुम बात करो ना, पहले बात करो, तुम प्रॉब्लम स्टेट आउट करो.
Absolutely.
उससे ही मोस्ट ऑफ द टाइम्स तुम्हारा प्रॉब्लम सॉल्व हो जाएगा.
Absolutely.
So like that, in the act itself,
Yeah.
are there some things that can be done कि भाई कुछ एक पर्टिकुलर पोजीशन है
Right,
जिसमें you are going to ejaculate faster.
Faster. Right.
ऐसा कुछ है?
Not really, no, because what works for me may not work for you. What
Ajay.
I find pleasurable, you may not find pleasurable. But I would say for anything, like for our audience, I assume that this is mainly men are going to be following these tips. Always talk to your partner. Do not hold anything inside. Talk to your partner. If you can't talk about your desires, your fetishes, kinks, whatever, then you don't have a strong relationship. You should be able to talk about everything. Secondly, consent is key. If you want to try out something new, the first step is talk to your spouse or partner ki I want to try something new in the bedroom. Can we do this? And if the answer is yes and a full, hosho aaram mein bola hua yes, then only should you pursue that. But it's always healthy to talk. Without talking, there is no basis of a relationship, I would say, without communication. So communicate to your partner what you wish in the bedroom and explore together. And you will find some positions are more pleasurable for some individuals. Some may find something more uncomfortable, and that should be voiced. No one should be okay with discomfort. If either partner is not comfortable, सीधा बताओ कि यार मुझे ये नहीं अच्छा लग रहा है, we should not, and amicably stop then and there.
Ajay, there is this one thing which has been going on the internet.
Yeah.
But you will be able to tell us whether it is a myth or it's a fact.
Yeah.
कि जो positions है,
Yeah.
तो for example men, if you मतलब एक certain position होता है, if the woman is on top, then your whatever ejaculation or the whole act will last longer. ऐसा कुछ होता है क्या?
No, absolutely not. As I said, कि some men may get more pleasure in a certain, your mind may be stimulated with the woman on top for some people. For some people, missionary may be more pleasurable. So it's what you perceive pleasure as. What your psychology feels कि this is more arousing to me.
हाँ नहीं वो pleasure तो एक चीज़ हो गया. For lasting longer, I'm saying. Why? क्यों मैं बोल रहा हूँ? क्योंकि if the man is below the woman, तो this thing ejaculation has to act opposite to gravity.
Right.
तो वो logic से now this is just bro science.
Yeah.
I just want to get a scientific answer to it कि अगर ऐसे हम करें,
right.
तो does it make a difference?
No, absolutely not. It's makes no difference. Again, it's perception of pleasure. If I find this more pleasurable, and if my my neural systems are firing more energy on this, I will ejaculate faster in this method. But if conversely, so if you ask a person like me, I may be not like that position. I may like missionary more. For me, that may be more thrilling or empowering. So I may ejaculate faster in that, or I may last longer in a certain position.
क्योंकि क्या है, like logically, if you think, to last longer,
right.
what can be done during the act? वो करने के टाइम हम लोग क्या कर सकते हैं? So for example, now this is just pure logic which I'm using. Can the man use a position which he does not like so much, but his woman likes?
Right.
उससे क्या होगा? That person will be able to satisfy the woman,
Right.
but he is not liking that position so much.
Right.
So maybe he'll not ejaculate in that position.
Right.
So is that the right strategy?
It's not a right strategy because you're keying in the factor that if you don't like something, your body might just switch off your erectile capability on that. You may just lose interest in it. If it's cumbersome to maintain, the whole pleasure aspect is gone, then it becomes a chore. And then when it becomes a chore, there's no guarantee you will be able to maintain an erection in that position.
Okay,
That is a
but
big challenge.
चलो ठीक है कि वो चोर नहीं लगना चाहिए. It should be pleasurable to you. So my question is pleasurable enough
Right.
कि it maintains the erection, but it's
sure.
not like your favorite position.
Yeah, then doable. Then that's acceptable. As long as you're comfortable in it and you're able to, it's not your favorite, but you're able to maintain it, then yeah, that can help you last longer. Absolutely.
So ये strategy
Can work.
है ना?
But the most commonest strategy is keeping your mind calm. You may be excited, as I said, it's like a
वो
scratching
कैसे
itch.
possible है while doing
Exactly.
that?
That is the challenge.
How
That is
to
challenge.
be calm?
No. So calm in the sense, keep your system focused. I'm enjoying it, but it's not an itch that I have to scratch.
It's not a race. Huh?
It's not a race. I can space it out. If things are going too fast, slow down the pace. If you feel that I'm going to ejaculate faster, ask your partner to slow down. Maybe take breaks or maybe find a more gentler solution till your systems calm down a little. And then you can go on to it. Space it out. As I say, space it out. Don't be in a rush. If you feel you're going too fast and you're going to ejaculate, slow down. Keep your thrust slower. Keep your impact slower. Keep the erogenous stimulation a little lower. Then you can space it out and last longer. That helps. What some people refer to as edging, basically.
Edging.
Yeah.
Okay. So can you explain edging?
Edging
again?
is basically reaching
near orgasm.
but not allowing yourself to completely ejaculate.
So when you reach near orgasm, you stop.
Yeah.
ऐसा. Okay.
That is edging. Again, that should be routine, can be done routinely, but not always prescribed. It's very difficult to maintain that level of control. So not always possible for everybody.
Okay. तो अभी ये इम्पोर्टेंट क्वेश्चन क्यों है या आई एम श्योर यूल अग्री कि पिल्स यूज करना तो बहुत कॉमन है ना टू लास्ट लॉन्गर. व्हाट आर द नेचुरल मेथड्स?
Natural methods, okay, so mechanical, and we'll go step by step. So another pills ke siva, there's other methods such as suction devices which are there on the market. You apply a vacuum and a vacuum can temporarily enlarge your penis. It's not actually enlarging it, it's just stretching it because of the vacuum force. That is again for certain diseases and certain conditions we advise that. But yeah, natural methods to last longer, first and foremost, is a healthy exercise regimen. Get your testosterone levels up, get your endorphins high, keep working out. The healthier you are, the healthier your drive is going to be. So exercise is the first and foremost. A good sleep cycle. To be able to maintain erections you need a good sleep cycle. So good 6 to 8 hours, I would say 8 hours ideal. I don't know how many people can get. I certainly don't have the luxury of 8 hours, but at least a good 6 to 7 hours should be minimum for your sleep. And then of course a balanced diet of good water intake, your antioxidant consumption, simple healthy food is good enough.
और वो Kegel exercises.
Kegel exercises, pelvic floor exercises do improve, but the main function of Kegel exercises is urinary continence. It helps with increasing your continent mechanisms. And of course, improving pelvic floor health will improve your erectile abilities.
It does?
Yeah, it does.
मतलब कितना % help करता है वो? Like on a scale of 1 to 100.
I'll just tell you. In many studies, like of course international journals have done studies of Kegel exercise and their impact on erectile dysfunction. They report about a 35 to 40% improvement in the erectile function of men with pelvic floor exercises. So these men who had weak pelvic floors with standard Kegel exercise, they had a 35 to 40% turnout of a subset of 100. 40 patients were satisfied with the results and were maintaining good erections. When they say good, that means in minutes, more than a minute. Were maintaining. So yeah, there is a subset of patients who will benefit.
तो good enough है.
Yeah, it's
Actually,
good enough.
natural methods are good enough. You don't need like a pill or anything.
Absolutely. Yeah.
अभी it's just that वो exercises are like tedious to do.
Yeah.
And उसको regularly करना पड़ता होगा.
Yeah. They're not very tedious. There are degrees, of course. There's multiple. Kegel is just a broad term. There are multiple. But yeah, if you have like any other exercise, if you stay consistent, they're not as difficult. If you follow it, you can definitely see benefits on that.
So like दिन में कितना 10 minutes?
So it depends on what. So when we do surgeries for prostate patients, we ask them to give 1 hour a day. Because now we've removed the prostate gland, right? We've done a prostate surgery. So 80% of the continent mechanism is gone. So now the external sphincter, which was handling 20%, will have to do all 100%. So they have to put in an hour every day so as to maintain that continence, urinary continence.
हाँ वो तो प्रोस्टेट के केस में हो गया, बट लाइक अदरवाइज हेल्दी इंडिविजुअल में कितना
need not do it. Healthy individual need not do Kegel exercises. Kegel exercises are given to patients who are unhealthy or who have some problems. But otherwise, on a routine basis, you don't need Kegel exercises.
नहीं तो लाइक हेल्दी इंडिविजुअल ने अगर कीगल एक्सरसाइज किया
Yeah.
तो विल इट लास्ट लॉन्गर?
Can help him last longer. Definitely. Can help last longer.
है ना?
Yeah, of course.
तो वो डेली कितना करना
Say
चाहिए?
15-20 minutes is good enough on a daily basis. If you're doing daily religiously,
हाँ,
15-20 minutes worth of Kegel exercise is good enough.
और वाह,
That's a realistic number.
हाँ.
If I say 1 hour, no one will do it. 15 minutes हम realistically बैठे कुछ तो मूवी देखते कर सकते हैं, बट 1 घंटा कोई नहीं करेगा.
बिकॉज एज इजी एज इट साउंड्स कि कीगल क्या बैठे बैठे करना है ना.
Well, it depends. Some modalities, yeah, but it can be done in a room.
तो बट एक्चुअली मुझे ऐसा लगता है प्रॉब्लम वो है कि अगर कोई चीज़ टू ईजी है कि बैठे बैठे तुम करो, तो प्रॉब्ली उसको फॉलो अप करना रेगुलरली मे बी एन इशू, एज इन नॉट दैट अ हेल्दी पर्सन नीड्स इट,
Yeah.
बट स्टिल इफ समवन डिसाइड्स कि नहीं मेरे को तो आई जस्ट वांट टू मेक द एक्सपीरियंस होल एक्सपीरियंस मोर प्लेजरेबल.
So I'll tell you, if you are working out regularly, if you do have a healthy exercise schedule, or even if you're playing a sport regularly, you don't need to go in this direction. This is only for those that feel that something is lacking. They can do it as a fad. With fads, the most important thing is it's not going to last long. It's a fad. कोई एक आध दिन करेगा, 5-6 दिन करेगा, बंद करेगा.
Exactly.
So rather than focusing on this, if you're focusing on a regular workout schedule, ये आपके उसमें issues clear हो जाते हैं.
अच्छा, ये वर्कआउट
Right.
इफ यू सेइंग,
Yeah.
तो अभी अपने को करना क्या है? पेल्विक फ्लोर, यानी जो हमारे बॉडी में नीचे वाला पोर्शन होता है उसको स्ट्रेंथन करना है.
Yes. And the entire muscular, every support system that holds the bladder and your perineal muscles is the pelvic floor.
बराबर.
Yeah.
तो that तो can be strengthened with something like say a deadlift or squats.
Yeah. That's what I'm saying. If you do any compound exercises, you are targeting multiple muscle zones. So अब जब deadlift करते हो, you are targeting a large group of muscles. Squats में, so focus on compound complex exercises which target multiple muscle groups. That definitely helps. And yeah, never skip the squat unless medically indicated. Never skip the squat. Squat is one of the best exercises till date, I would say.
ये important information है. मतलब guys अगर
never skip leg day.
never
I don't
skip
know why
leg day.
people leg day is very important. Never skip it. So many benefits of that.
हाँ, मतलब लेग डे सिर्फ तो दैट मीन्स लेग डे सिर्फ मसल पुट ऑन करने के लिए यूजफुल नहीं है.
functionality,
functionality. Sexual life as well.
Sexual life, if you want to be mobile even in your old age, because we will discuss andropause when we get there, we'll discuss that even in your older age, if you want to stay mobile, you need bulletproof knees. Bulletproof knees come from regular training of your lower limb. So if you skip leg days, you're not going to have a strong lower limb. You're going to spend most of your life on your feet. Might as well take care of your lower limb on a regular basis.
Because usual थिंकिंग कैसा है कि देखो अभी तो मैं अनहेल्दी हूँ, अभी मुझे अगर हेल्दी होना है तो I'd have to be like you said a hamster on wheels.
Yeah.
लेकिन मेरा आर्ग्यूमेंट ऐसा है कि हेल्दी लोग ऑलरेडी हैमस्टर ऑन व्हील्स ही है, वो लोग ऐसे घर बैठे बैठे हेल्दी नहीं है.
Right.
सो बेसिकली अगर आपको हेल्दी रहना है तो हैमस्टर ऑन व्हील्स तो बनना ही पड़ेगा.
बनना ही पड़ेगा. It's a continuous cycle. Again, that's perception. Abhi we see it as, we are saying it hamster on wheels. But for people like you and me, even I like a good exercise. So for us, it becomes a pleasurable act. It does not become a hamster on wheel. For us, it becomes chasing time. Like you've been on a fitness journey for quite a while. You enjoy it. So for you, it's more of a exploration. Ki chalo, I'm doing something new. It's not a pain or something. Yeah, but those who do not like exercise, for them, it's going to feel like a drudge. That's why choose activities you enjoy. Like you have so many sports, you have newer sports like pickleball, you have lawn tennis, whatever. Choose something that suits your fancy. Exercise, going to the gym. Some people hate it. Some people hate कि यार मैं weights उठा रहा हूँ. Why? Fair enough. Join कोई खेल खेलो. Play something where you're actively using your brain, whether you're actively branching out, you're using different muscle groups. Keep weightlifting a part of your week. Don't do it every day. Do it some days. Some days play a sport. Can balance it out like that.
Except chess.
Yeah, I mean chess not gonna get a lot of
weightlifting से कितना ही है.
You'll have strong hands. Fingers actually, not even hands.
So that. And since you mentioned about fetishes, now we'll come to fetishes.
Oh yeah, the juicy part.
तो अभी ये fetishes हम लोग ने जितना नेट पे देखा है, fetishes is a very western thing. I don't know, maybe अभी अपने यहाँ पे भी ancient time से होता ही होगा. But we have been all of us have been exposed to it as a Western thing.
We've been, right.
Maybe.
Yeah.
In most cases. लेकिन इंडियन कॉन्टेक्स्ट में क्या होते हैं fetishes and क्या fetishes आपने देखे हैं?
Right. So fetishes, first of all, you said Western. Yeah, we've been exposed, but there's nothing Western about it. It's been in the East. We have entire temples in Khajuraho and all which depict all of those fetishes. So it's been there. It's always been there. It's just that the West has remarketed it and resent it to us. तो हमारी चीज जो हमें पहले से पता है वो repackage करके बस 50 Shades of Grey novels और इसमें से हमारे जनता तक पहुंचाई है. So there's nothing new about it. And yeah, we see a lot of fetishes in a day-to-day basis. Again, as I may sound like a broken record, the first thing of fetish is consent. What works for you, it has to work for your partner. It's not a one side कि यार मैंने चलो आज ये बुक में पढ़ा है, ऑनलाइन देखा है. Does your partner agree to it? If the answer is yes, then you can proceed, discuss the terms, and then go ahead. So fetishes, the most commonest ones patients come with is BDSM. BDSM is the most common because it's the most publicized. You have novels, like, you know, women may not watch porn as much, but they'll read the hell out of it. So 50 Shades of Grey has taken care of that. And a lot of people come ki we want to try this or we have tried this. Are we doing it right? The media, basically social media and online world has exposed this. So there's nothing bad about fetish as long as no one is getting harmed, as long as it's consensual and it's being discussed. Weird fetishes, I would say that most commonly people wanting to have sex outdoors. That is a very common fetish. Outdoors. Ki I want to be, you know, that thrill ki I want to get caught. That
Acha.
Yeah. Then you have a lot of fetishes these days because again porn addiction. People want to watch their spouse have sex with other people. That is also common fetish which has come because of porn. Watching porn rewires the brain of the spouse. I want to see my spouse do it with someone else. That has become a big, you can say, big presentation these days. Because of watching porn, you sort of, the act of watching it has become more pleasurable than doing it. So they like watching their spouse with somebody else. That is a fetish we do come across. Yeah.
चलो नेचर में कर रहे हो तो ठीक है, समझ
वो तो ठीक है, बट आउटसोर्स ही कर रहे हैं ये मतलब नया, इट्स अ न्यू वन
ना. आउटसोर्सिंग का भी लिमिट होना चाहिए.
ट्रू.
But like, are fetishes normal?
So,
is it a normal thing?
Normal, what's normal for me may not be normal for you, right? So fetishes, each individual is allowed to have their own, you know, sexual freedom and their own sexual exploration. So fetishes, as long as they're healthy and not harmful, yeah, they are healthy and acceptable. It should not be causing harm to a partner. It should not be causing psychological or physical duress to anybody. Till though that realm is respected, yeah, they are healthy. It's always natural to try out new things. Same cheese karke you are going to lose interest. You are going to get bored. It is, if you are exploring a healthy, safe alternative without hurting anyone, yeah, then it's absolutely healthy.
Yeah, but you mentioned like something called BDSM now.
Yeah.
It sounds a little harmful.
Yeah,
मुझे पता नहीं.
It can be.
But it sounds a little harmful, and even if first of all, is it possible to explain what is BDSM?
So it's basically, BDSM is your acronym which stands for bondage, dominance, sadomasochism. So yeah, there is an angle of pain involved. There is an angle of degree of slight discomfort involved. Some people do get off on it, and I would say again there have to be acceptable limits. So talk first. Talk to your partner. What works for you? What are you comfortable with? The moment it stops becoming pleasure and just pain, that is a layer where you should draw a line and stop it. That's why they say you should have a safe word for your limits. So that is extremely important to communicate this with your spouse or your partner. कि ये चीज़ मुझे नहीं अच्छी लगती, then you should just stop it there. There should be no what if. If it's no, then it's a no. There's no compromise on that. But yeah, within healthy, non-harmful levels, it's acceptable form of experimentation. Yeah.
क्योंकि by the sound of it, it appears harmful. मतलब it sounds harmful.
It does sound that way.
And you're saying कि ठीक है चलो harmful भी है अगर तो तुम उसको plan out करो.
Talk कि ये चीज, like, you know, a little bit of discomfort is okay for me. A little bit I'm okay with pinching. I'm okay with the little, I enjoy spanking. But yeah, it should not be spanking so hard that it leaves a mark on my body. I don't enjoy that. This has to be communicated before. And in most cases it is females who are either bound or whatever are you know, the receivers. In some cases it's vice versa. But either which way, both the partners have to be on the same page कि ये मुझे अच्छा नहीं लगता है या ये मुझे पसंद है, ये करो. और when I say stop, that has to be mutually acceptable.
Yeah, because वही ना वो थोड़ा पैराडॉक्सिकल साउंड करता है कि ठीक है
it does.
यू नो ये थोड़ा एक हम लोग एक्सपेरिमेंट करने वाले हैं, माइट बी हर्ट, इट माइट हर्ट यू,
Yeah.
बट वील प्लान इट इन सच अ वे कि ठीक है हर्ट को लिमिट करना है
Yeah.
और उससे मज़ा भी आना चाहिए.
It should be acceptable to you. It should not be hurt. It should be pleasurable. Even that pain should not be pain. It should be just a slight pain of pleasure. Like for example, spanking. You should enjoy that spank. It should not be a hurtful spank. It should be a spank that maybe just makes you feel good about it, but nothing painful. I say these boundaries have to be designed before. Go ahead.
So yeah, I mean a lot of intricate
Yeah.
shit this
Lot of-
whole thing is.
Behind locked doors kind of stuff.
And it is not as simple as it looks.
Yeah.
There are a lot of little things, little details
Yeah.
जो आपको take care करना पड़ेगा
Absolutely.
to have like a
Yeah.
healthy sex life.
Yeah.
And I think something which is not talked so often is andropause.
Yeah.
Because menopause तो
Yes,
ठीक है
there's
चलो,
tons of material on that.
हाँ, but andropause क्या है?
So basically, we've now scientifically identified that as men age, your serum testosterone levels tank. After a certain point, they are going to reach a level and they're going to tank below that. And it is, it happens around your 50s and 60s most commonly, is when men start feeling that midlife crisis wali jo hum feeling bolte hain. This is a certain facet of it that I no longer feel as strong as I used to. When I was a 25-year-old, even we've experienced it now. You and I are in our 30s. When we used to be 18 and 19-year-olds, we could do way more things before, physically. And now, even though the difference is not so great now, we have certain limitations from our 15 and 18-year-old bodies.
Yeah.
Similarly, when you cross your 50s, 60s, when you've reached your midlife, and you're, getting into that old age spectrum, you start feeling that I'm not as strong enough. I've lost interest in life. I'm losing muscle mass, maybe hair. I'm getting more fatter. Muscle is being replaced with fat. And my sexual interest and passion has gone down. So these are all a systemic, you could say, hypogonadism occurring because of a sudden drop in your testosterone levels. And it is a unfortunate but sad reality that this does happen. But there are ways to soften the blow. There are ways, if you maintain a good critical muscle mass, if you have a disciplined exercise routine where your muscle and bone density are maintained, you may not be so badly hit. Those aches and pains which we commonly associate with old age can be severely reduced. Like for example, my grandfather, he lived till 92. He exercised up to 10 days before his death. 10 days before he got COVID and we lost him in COVID. Before that, he was exercising regularly an hour. He would do headstands for 10 minutes every day. Literally stand on his head. He had maintained a critical muscle mass. He started workout at the age of 6, 7. Discipline started by his father. And he did it till the age of 92. No mobility issues. He was able to walk the entire... Yeah, there's never been a single bedridden day in his life.
Oh,
Yeah,
that's
the
so
last
amazing.
3 days of his life he was bedridden. Otherwise, he was walking the entire time, and walking like you and me. He was able to climb forts. He would come on treks with us. In fact, he was operating in the operating room till the age of 91 and a half. Before COVID, he assisted my father, and he stood for 6 hours holding a retractor without getting tired. So he somehow defied aging in my mind.
That is so amazing.
yeah.
क्योंकि यहाँ पे like if someone does not take care of their health,
Yeah.
तो 60 के बाद
Yeah.
the down slope is so steep.
It's steep.
तभी तक realize नहीं होता है.
Absolutely.
तभी तक it's like okay ठीक है slowly हो रहा है. But the hardest part is that steep slope.
Steep slope.
वो एक बार आ जाता है.
And that's it. Then you suddenly feel, oh my god, I've aged. I'm old now.
हाँ.
Because it's a testament. Your body, as you age, the repair mechanisms of your body also slow down. That's why when you're an infant, wounds and injuries heal very quickly. Conversely, as you get older, healing mechanisms slow down. So suddenly, as you described, because you've not taken care of your body for so long, it decompensates. And suddenly you feel shit. I'm no longer manly enough, or I'm not strong enough. Best way to deal with it is start working in your 20s and 30s. So the blow and the problem is less at that age. So yeah, it's a holistic measure. Some severe andropause cases, you may require testosterone replacement therapies, either in the form of pills, injections, or patches. But testosterone replacement may be required in these cases. Yeah.
अच्छा, and for like enhanced function, some people nowadays, अभी क्या 40 पहुंच गया मैं, मेरा टेस्टोस्टेरोन ड्रॉप हो रहा है, मुझे पता है, मुझे बस वो अभी नॉर्मल चाहिए. आई एम नॉट हैविंग एनी प्रॉब्लम, बट मेरे को मेरा टेस्टोस्टेरोन नॉर्मल चाहिए. उस केसेस में ले सकते हैं टेस्टोस्टेरोन.
So again, now the time of history which we are living in, the testosterone of a 30-year-old male is the same as a 60-year-old male in the 1920s and 30s. So our
Really?
our basal testosterone levels have dropped in the last 100 years. And many factors there, of course, huge papers and a lot of stuff has been there. Your environment, your microplastics, whatnot. There's so many reasons attributed to that. But we are not as manly in testosterone terms as our predecessors were. So we have to accept that, unfortunately, this is our new range. Yeah, if you're not able to find the cause of your testosterone levels decreasing, if natural methods and natural solutions aren't doing it for you, if you've tried everything, you've tried your supplements, your L-carnitine supplements, your exercise, your diet, you've tried to modify that, if that is not working, then yes, you may require a TRT to keep it normal.
No, but for enhancement, should people take it?
I would say avoid it unless it is, unless, as I say, unless it's affecting your functioning. If you're a happy individual, if you're functioning normally, then you need not do it. Yeah, if you are feeling that suddenly I've lost interest in life, my sexual health is declined, I'm not able to perform, I've lost muscle mass, I'm losing hair, then yes, then you need to consult a endocrinologist and maybe get some therapy for that.
Or maybe for gaining muscle in your 40s?
Not needed.
Not needed.
Because that is non-physiological muscle gain.
Yeah.
If you do it physiologically,
Normal
it's
नहीं है
more
वो,
than
हाँ.
enough. जितना आप naturally normally कर सकते हो, more than enough.
नहीं, ज़्यादा करना है तो
क्यों करना है ज़्यादा?
बस aesthetic reasons के लिए.
I would not chase. All that glitters is not gold. Don't chase everything you see. Another point I've noticed is a very conservative view, but social media has really wrecked body images for people. Men want to look like all the influencers. Men want an 8-pack. Those individuals work round the clock to keep a physique like that. It is not feasible for people like you and I to have a 10% body fat ratio. Right? We cannot be dehydrated.
Working people के लिए वो feasible
Impossible
नहीं
है.
है.
और करना भी नहीं चाहिए.
They work round the clock. This is what people I think need to understand.
Exactly.
It's their, even if not their full time job, आधा दिन तो उसमें देते ही है वो लोग.
Exactly.
मतलब आप ट्रेन में 2 घंटा ट्रैवल करके इतना बॉडी मेंटेन कैसे होएगा?
Difficult. And round the clock, right? Have this on time.
Meals on time, have sleep on time.
कैसे possible है? It's very difficult. Especially if you have kids. You're not going to get a good night's sleep while the kid grows up. If you have work deadlines, कैसे possible है? Most people, like these bodybuilders, so they spend 2 to 3 hours in the gym on a day on an average before their competitions. They get dehydrated before the competition, so the muscles look more
And
bulky.
dangerously dehydrated.
Dangerously.
To the point कि कुछ भी हो सकता है.
So have you seen the movie 300?
Yeah.
Right, so the interesting fact is, before they shot the scenes, the fight scenes, they would work out for 2-3 hours and they would be severely dehydrated before those set. That is why Leonidas and his men have those ripped physiques. Yeah, the reason is 3 hours non-stop workout करते थे वो 2-3 घंटा, and set पे dehydrated जाके they'd get oiled and then they'd stand. How unhealthy is that? I mean, if you and I did that, we'd probably faint in the Bombay heat.
बराबर.
Yeah. So maintain aesthetically pleasing, I understand, but know that you're not always going to have a six-pack, you're not always going to be able to maintain, and accept that. Try to maintain a
Like
healthy.
if you're not like a health influencer or something, if you're not in the fitness industry, तो फिर वो करने को जाओ भी मत.
Just keep your
फालतू का
BMI
risk
below
है वो.
25. Eat healthy, eat what you like in moderation, and as long as nothing is bulging out and you're comfortable, no need to worry.
Because even with TRT, एक तो TRT का ऐसा है कि अभी TRT का तो pills भी अगर testosterone का pills भी मिलता रहेगा तो I'm hoping that they are strictly regulated. ऐसा you can't like walk up to a pharmacy and उसको
you can't.
बोलो कि मेरे को testosterone दे दो तो वो देना तो नहीं चाहिए.
And it is regulated, but again, as mentioned, that enforcement of these regulations, like unless it's enforced strictly, there's always a bypass mechanism, but ideally they are prescription only.
That and then चलो किसी ने कह दिया चलो मेरे को करना ही है, I want to look good, XYZ for whatever personal reasons. तो is there a safe way to do it?
Testosterone therapy?
Yeah.
Testosterone replacement therapy is not advised for normal males. It is not a part of standard treatment. यानी हम पेशेंट को ही बोलते कि आपको जरूरत नहीं है तो नहीं करना है आपको. अगर टेस्टोस्टेरोन लेवल नॉर्मल है बट आपको बूस्ट करना है तो आप नेचुरली कोशिश कीजिए. बट देयर इज नो रिकमेंडेड थेरेपी कि आप दवा लीजिए उसके लिए, बिकॉज दैट्स अननेसेसरी. अननेचुरल, if you tweak unnaturally, you are going to have to deal with complications unnaturally. So I don't prescribe that, and I think standard medical practice also does not prescribe this as a regimen.
नहीं, but हाँ अच्छा, okay, good point. लेकिन अगर पेशेंट आपके पास आया, he's not even a patient, he's just saying
I want more testosterone.
I want more muscle mass.
Right. So I would then first say that, okay, why do you want more muscle mass? What is your, like, if your reason, if it's aesthetic only, then I think you may first need to take help from a mental health expert. Because why do you need to bulk up? What is your cause? What are you trying to?
See, for example, that person is an actor, wants to do a movie.
Okay.
ऐसे केस में वो आया, otherwise he's completely normal.
Yeah.
So उस केस में can doctors prescribe?
No.
TRT?
No. Should not prescribe. Should not. No doctor in the right mind should prescribe this because it is not advisable. You are interfering with the body's natural mechanism.
Actors जो है, अभी उनका हम लोग मूवी में वो लोग इतना ट्रांसफॉर्मेशन करते हैं. That's not natural.
It's not natural. Some of it is CGI. Some may be taking steroids, but it is never advisable to go down.
वो जो some of it is taking steroids वाला part है, वो legal भी तो होना चाहिए ना.
Well, I mean, who's going to check? My question is, कौन जाके check करने वाला कि भाई तूने ये लिया?
And the thing is, अभी चलो people see कि अच्छा ठीक है ये पॉसिबल है, तो दे फाइंड आउट वेज कि भाई मैं भी कैसे ना कैसे जुगाड़ करूं और अपना भी अच्छा बॉडी हो जाए. चलो ठीक है, एटलीस्ट डू इट इन अ सेफ वे
और डोंट डू इट एट ऑल.
That is so like the best.
Safest is don't do it at all because it's a rabbit hole. You go down it, there's no coming back. You take one pill, you take one injection, muscle gets bigger. You want to keep getting bigger and bigger. There was a bodybuilder, I think Ray Pinata. What is his name?
Rich Pena.
Rich Pinata. Right. Rich. How do you pronounce it?
Rich Pena.
Rich Pena. Do you see what happened to how he died? He had abnormally high muscle mass. Right. He was on a cocktail of drugs. And he was obsessed with the way he looked.
5% wala.
5% bas, and he died in a hotel room in a very untimely death. And that is not far from reality. I mean, you see patients like these, they have unnaturally high pulse rates. They have unnaturally high muscle mass. Your body has to work so hard to maintain that. The steroids which you take are also going to affect your kidneys. There's a chance of kidney injury. Do you want to risk looking like a rhino, right? Or lying in a dialysis machine? Is there a trade-off? कि यार मैं ऐसे दिखना चाहता हूँ and I'm okay. मतलब are you okay with lying in a dialysis machine if your kidneys fail or if God forbid any other complications occur? There's a bleed in your brain. I think that the trade-off is far too high for these things.
Yeah, absolutely. But like फिर भी you and I know कि there will still be people who will still do it. For them, what's the sweet spot? अभी steroids तो चलो बहुत क्लियर है कि यू शुड नॉट टेक. टेस्टोस्टेरोन रिप्लेसमेंट, अभी टेस्टोस्टेरोन इज आल्सो स्टीरॉइड ओनली, बट इट्स स्टिल वो नेचुरली तुम्हारे बॉडी में है. तो अगर तुम उसको एज अ रिप्लेसमेंट ले रहे हो तो व्हाट इज द स्वीट स्पॉट या ऐसा कुछ है? क्योंकि
नो स्वीट स्पॉट. व्हाटएवर
टेस्टोस्टेरोन तुम लोगे तो वो तुम्हारे बाकी ऑर्गन्स को भी इफेक्ट करने वाला है.
yes,
राइट. योर बॉडी probably won't be able to sustain that much testosterone for life.
Absolutely. So there is no sweet spot. I would say that as long as if you have taken testosterone, taper it off and get off it. Because let your body, because even after you stop it, your body is going to stop, because you're taking an external source, you're giving a feedback loop to the body. So body is going to lower its production or slow its production.
Body नहीं produce करेगा.
Body थोड़ी देर बोली अभी मिल रहा है तो अपन शांत बैठते हैं. After you stop it, there's going to be a sudden dip. Then it will take a bit of time for it to recover. So slowly taper it off. Let your body, get back to its old mojo and just stop it. There is no sweet spot. Just don't do it, in my opinion. Stay away from it. Unless medically indicated, don't do it.
So and you mentioned that you have a patent for a medical device.
Yes. So I filed multiple. I've gotten my first approval recently.
And what is that process?
So the process in the sense of getting the patent. You want to know the entire process, like step by step, how
like in brief.
So in brief is basically all my patents and all my medical technologies are aimed at making the process cheaper. How can I make a surgery cheaper for the patient? That is my main aim. Because I see so many patients, and the biggest thing is you are one day away from bankruptcy. One illness and you can be bankrupt. So my aim is how can I reduce the burden through my inventions. Existing invention को मैं सस्ता कैसे बनाऊँ और surgeon और patient को भी pinch नहीं होनी चाहिए. Surgeon should not have a hit in his day-to-day life. Patient should also not feel the pinch. So the process of the patent was first finding out an idea, finding out a problem, solve that problem, find technical solutions and make technical drawings of your new device. How is that device going to beat current market devices? And thirdly, are you infringing on anyone else's work? So you have to do I did a thorough search of that, and once I was able to prove that yes, I do have a novelty, then I filed for a patent, legal patent for that.
That's amazing. मतलब to see a doctor who is a doctor and also makes medical devices is pretty unique. I haven't come across anybody so far.
Thank you,
That's
thank you.
so amazing. And so yeah, wrapping it up, thank you so much for discussing such amazing things about men's health, which is often mental health is talked about a lot these days, but men's sexual health के बारे में बात कोई नहीं
It's
करता
not
है.
talked about.
So I think that was really important, and I hope people find this helpful.
Thank you so much for having me. Thank you.
Thank you.